Again, welcome to our webinar series, Spotlight on Structured Literacy. My name is Lama Farhan, and I serve on the IDA Georgia Board of Directors, and I'm the co-chair of the webinar and conference committees. On behalf of the boards of both IDA and the Reading League Georgia, we are pleased to be offering this webinar series for the fourth year. IDA and the Reading League are committed to providing information on evidence-based practices to educators, parents, and advocates. In doing so, we hope all students will have access to structured literacy instruction. In this four-part series, our speakers draw on the science of reading and the science of the teaching of reading. In tonight's webinar, Dr. Tim Odegard will discuss that beyond its impact on reading and writing, dyslexia's primary characteristics significantly affect mental health and overall well-being. These modern realities challenge us to consider how we define, approach, and address dyslexia. This webinar explores the implications of word-level difficulties characteristic of dyslexia on mental health. It also examines research that has aimed to address the mental health challenges prevalent among individuals with dyslexia. Before we begin, thank you to those who submitted questions when you registered for this webinar. As a reminder, if you have other questions, put them in the chat box. The chat will be monitored this evening by Elizabeth Hogan, President of the Reading League Georgia. During the Q&A, our speakers will address as many of your questions as time allows. And now it is my pleasure to introduce our speaker. Dr. Tim Odegard is a professor of psychology at Middle Tennessee State University. He holds the Murphy Chair of Excellence and leads the Tennessee Center for Dyslexia. He also serves on the as the editor-in-chief of Annals of Dyslexia and is a consulting editor of the Journal of Learning Disabilities. He is a past editor-at-large for Perspectives on Language and Literacy. Dr. Odegard is a contributing author to the IDA Knowledge and Practice Standards for Teachers of Reading. His work extends to putting research into practice by supporting efforts in the US and Canada through service leadership to ensure the human right of literacy for all learners. He has received the Innovator Award from the IMSLEC, the Luke Wade Service Award from ALTA, the Massey Sexton Dyslexia Advocacy Award from the Tennessee Branch IDA, the AIM Institute Founders Award, and the Research Excellence Award from the University of Texas, Arlington. Please join me in welcoming Dr. Tim Odegard.
Thank you so much, Lama, and everybody else with your organization from from Georgia IDA and the Reading League for having me here. And thank you guys all for taking time out. I have less than an hour since we want to, save space for questions. So the points I want to make, I think, are fairly straightforward. And I think that many of you probably have a good grounding in some stuff. So I will address a few things off the bat. I have a shameless plug, which is I do have a PhD program I'm attached to and I'm faculty with, and we are able to offer some full assistantships now. So if you're interested, you can look into our program by following the information here and find out more about this. And it does offer the ability to have a remote option of coming in through Zooming into the program. So if you want to learn more there, you can. So I wanted to set up my buddy Hugh Katz for his presentation as part of this webinar. So I will do a real short intro as far as talking about language and its relationship to reading and highlighting how much of what we've talked about so far has really been on the academic side and the language side of things. That'll really set us up well to think about dyslexia and also think about its interaction with written language. Then I want to talk about how we're really documenting with beyond a doubt what I think anybody who interacts and works with my community, those of us with dyslexia or parents like myself of individual with dyslexia, either as a teacher or somebody else, or maybe you have dyslexia, you know the toll it takes on our mental well-being. And we're really identifying the different pathways for that. And then of course that leads us to, then what do we do? How can we address that? Which we've had some real gains in the past 5 years in the United States, and actually some research that has actually predated in Italy and elsewhere about what we can learn about how we intervene and where each of us plays a role in this part. So let's talk about the language basis of literacy. Maybe you've seen me present before, and I kind of have this set of slides that I always like to start off with. And maybe you've seen me do this, but I mean, it really goes back to the fact that oral language is a very old human thing. It's deeply ingrained in our genome. It's something that we're born with the capacity to learn based on exposure. So much so that I'd love to start off with this quote from Pagel, who's an evolutionary researcher out of England. So by possessing language, humans have had a high fidelity code for transmitting detailed information down the generations. Well, that would have been through oral traditions, right? By actually passing them down over the stories that we told. Many, if not most, of these things we make use of in our everyday lives rely on specialized knowledge or skills to produce, right? We have to communicate all of this to other people. The information behind these was historically coded in verbal instructions, oral language. But we invented as a species writing, and it wasn't that long ago. And this has unlocked our potential for changing fundamentally how literate societies function and the importance of those language pieces of processing that are then used and needed to allow us to become literate. And that's the rub. Oral language is always there. And we have invented over the past for the past couple thousand years, this ability to write things down. And that has transformed what we do as a species. Now, Lama is actually a speech language pathologist. And I do like to highlight this for all of us to really ground this in language, that we talk about both oral and written language. So oral language is there, it's what we're doing. Written language is a symbolic representation, and how we get through meaning from those symbols is through oral language. You don't see the meaning written in those words, as all of us know, whether or not it's a Chinese figure, whether or not it's kanji from Japanese, whether or not it's a script from Sanskrit or from Arabic, or an alphabetic language out of Europe. The letters and the characters do not contain the meaning. It's translating those into language that allows the intermediate for us to get to meaning in the transmission of knowledge and information and communication, either in person, over a Zoom ether of the internet, like I'm doing right now, or through the ages as handed down through preserving things in written form. We have listening and speaking, which come pretty automatic to us as a human child, and then written language, which we are taught skills that through practice, we then acquire for ourselves the ability to be literate. And I think that's really important. And I have been struggling my entire career over a couple decades now to communicate this well. I think I've finally kind of landed on it, because I really stumbled on this back in a conference this fall at IDA, because I said jokingly, it's like, it's not like the Matrix. We don't just stick a stem stick in our head where all of a sudden it's like we're Neo and we know Kung Fu. It's that as educators, which I happen to be an interventionist in instructional literacy, we work very laboriously with children. Some it takes more effort than others, and we equip them with these skills that they can use to then engage with written language and through their practice acquire literacy for themselves. And I think we take that for granted. And one of the things that's dawned on me recently is, because learning that was so very hard for me and effortful, it made all the work that I had to do that much more real for me. And I do think that as parents and educators, as policymakers, I think we often forget that it's not us that are doing it for the child, it's the child who we are giving skills and support so they can do a lot of work for themselves. And I think by keeping that in mind, it helps us remember, especially when we get to the mental health side, what we're doing and how we're trying to enable them to do a lot of work. The other thing that I'll also say, especially being here in Tennessee and working so closely with other states that are implementing science of reading legislations here in the United States, and as other countries like Canada and American similar things, is we can't forget the practice time. You do have to practice with connected text and give opportunities for that. And so the amount of practice a child does, either at home or right in front of you, and how much scaffolding it'll take for make sure that practice is worthwhile for them and helpful for helping them acquire that literacy, will really be important. And as I've been listening to the students in my graduate classes come back about the initiatives here in Tennessee, I'm hearing that they don't have enough time for practice, and they're not really engaging in that meaningful engage of the language there to apply what they're learning. And that concerns me deeply as a cognitive scientist and somebody who's deeply steeped in research the science of learning. So to highlight this, I always make three big points here. Oral language comes first. Evolutionarily, it came hundreds of thousands of years ago, and as a development of an organism, it comes first in our development. Two, those things that I was just highlighting, we teach skills to children directly. They use those skills to enable them to practice and acquire literacy for themselves. And I don't know if that's going to make sense to you or not, but to me, as a person who struggled so profoundly, I know how hard I had to work. And what most people forget who learned it so easily is you forget that you did that work too. It just came more naturally for you too. And it didn't take you as many practice opportunities to acquire it. But you too didn't just learn by being taught your alphabet, your letters, and how they map to one another, no matter what orthography that you were learning, even if they were characters. But the effort that it took in that practice is really different too. And so it doesn't make it as demonstratively real, I think, unless you struggle as much as people like I do. And then three, we can't forget that oral language is ever present and is always developing in line. One of the things that in the United States we've forgotten is that we start off with oral language skills, and then when we get introduced and we're acquiring print skills, those are feeding off of one another. And also, they're going to feed in both aspects of written forms of the language, but also in the meaning forms and vocabulary acquisition. So it becomes this symbiotic relationship where now oral language and written language are feeding and driving one another. And as I said, I like to take the long view of this. So they argue about exactly when, but a very long time ago. Not in the span of our entire existence on this planet and the planet's age, but 240,000 years is roughly what it's been that our species developed the capacity to use oral language. This has resulted in the refinement of highly integrated brain areas that allow us to produce and receive and understand oral language. But roughly 26, 28, maybe 3,000 years ago, we invented writing systems. I could go on about this. I love to talk about this. There's people like David Sher and Marianne Wolf and others who are much more knowledgeable about I am. So I'd suggest that you read an upcoming book article that David Sher has coming out in Reading Research Quarterly if you want a little bit of that, or go back and read Marianne Wolf's Proust and the Squid if you want to know about some of this history. But it's really important to realize that no one culture invented in isolation literacy. They kind of co-emerged across different civilizations across the entire globe. And I think that's a really important fact to remember, that we had things happening in China, we had things happening in Mesoamerica, we had things happening in the Middle East, we had things happening in Greece and elsewhere that were emerging kind of as humans were applying their oral language and finding ways to preserve it in written language. And I think that's important to keep a global context. Children are going to learn to understand and produce oral language from this exposure because of those pre-wired areas which are hardwired into our genome that give rise to the development of these key areas. There are language learning differences and developmental language differences that can impede the ability for them to understand how you put words together well and understand what other people are saying. Those are developmental language disabilities that you'll hear my colleague Tiffany Hogan talk about, for example, or maybe Hugh Katz talk about. Those happen much earlier in development to start to manifest than a reading problem, because oral language precedes developmentally your written language abilities. So you will be able to identify and detect a DLD issue much earlier in a child's development than a reading issue, because you're not able to actually see if they're learning how to read yet. Makes common sense. So we must directly teach these skill sets, which will be slightly different depending upon the writing system that you're teaching the child to use, but they're all going to be used to represent oral language. And then the specific aspect and nature of the writing system and what alphabetic language they're learning, for example, or which graphical language system, such as Chinese or kanji, they're learning, will influence how, let's say, dyslexia will present. But in all cases, it's a word level issue. And it's how the words are represented in the written symbols, which will then manifest and do it. The other thing that I want to show you some evidence for in a few slides is that what's persistent across all of these is the automaticity piece. Those of us with dyslexia are difficult to get automatic with word level reading issues. We'll learn through more research if it's also spelling too that are automatic, but In certain languages, the length it takes to get highly accurate is longer and takes more practice. And in English, because of the depth and the complexity of our language, it's very pronounced and prolonged. So it takes a whole lot of practice to become an automatic reader and writer for anybody, but especially for people with language-based learning differences that are hindering their ability to learn and acquire the skills it takes to learn those printed symbols and extract meaning from them. And as I've been highlighting, individual differences exist and will impact the acquisition of that in all languages. And we're going to see that in children, they're continuing to develop their oral language, acquiring development of those. And we need to remember what I was highlighting earlier, is that meaningful impact with deeply reading text that's super critical and important. That's the whole reason why we're doing this, is to be able to deeply engage and to understand what is written down in the text. You probably have seen this image from Dehane. It's a graphical representation of his review from 2009 of the brain imaging research that had been done by myself and others up to that point. I think almost all of my brain imaging studies were published before 2009 in this area. So what I'd like to show you is that me and my colleague Emily Ferris used a neurosynth database, which is brain imaging data collected from individuals doing actual different activities in an MRI scanner where they're scanning their activation. So what you're seeing is not an illustration, you're actually seeing a composite from thousands of individuals who are reading English in the scanner. And that purple area represents areas that are activated when they're reading English. That's the left hemisphere of the cortex. I always like to do this just for fun because I'm at home. So if I pull out my brain here, that would be this. It's in 3D. And this is the left hemisphere that we're looking at. Front of the brain, back of the brain, cerebellum and brainstem down here. We'll put this to the side now. So you're seeing areas activated across that. I'd like to show you that the reading brain doesn't exist as far as a reading brain goes. What it is a language brain and all the other parts that we've had to co-opt together as we invented the ability to transcribe oral language into writing. Because I can show you all the activation on that scan right there from real people without ever showing anybody print. What I would do is I would have them hear auditory information in human voices. And you'll see all those language areas for auditory information lighting up in the left cortex there. I would show you activity from having them think about the meaning and engage meaningfully with information they're presented, with never showing them print, which would be those green areas down there where they're processing the meaning, the semantics of information. Then I would say, see the overlap? See, by when you activate aspects of oral language in the cortical regions, you're activating the same areas that it takes when you read. I would say, look at this. When you're processing the meaning of information without actually processing the print, you're doing what we do in print. We're going from print to meaning. It's obligatory when you're a reader. So you're going to be activating those areas. I'd also say that because it's a higher order ability and skill set, it takes attention. And so, of course, the attentional networks, when we have individuals do attention tasks without letters or without words where they're reading, you'll see that activation. It's also a visual task because we're taking what's auditory and also visual for processing the speech cues that we see in the mouth formations. We're taking that visual from the letters, from the iconic graphic features and characters from a Chinese script, for example, the diacritic markers from an Arabic script, for example. We're taking those in and we're processing them. So of course, I don't have to show you words to activate attention, but attention is represented because it takes attention to focus and read. And of course, it takes your visual processing as well. So if a person had an attention problem, it could give rise to reading problems. If you had difficulties with processing and doing pattern recognition in your visual word form area, it could be a challenge for you to read. If you had issues with understanding the meaning of things, especially the speech side of things, it would impact your ability to read. And I don't have to show you any print to activate the composite areas that it takes to come together to generate what people call the reading brain. Now, I'd also like to show you that because it's language and oral language, and we're taking and putting into print, it's not surprising that at some level of analysis, very similar cortical regions in the brain would be generated across different orthographies. So take English, for example. I showed you that left, right hemispheres. You see that activation. This is taken from an analysis that was done where they were looking across different studies and they were pulling it together to show you the generalized activation here. What about Hebrew? What about Spanish? What about Chinese? This is showing you that the same types of oral language areas are activated when you're presented with print. The same visual areas are activated when you're presented with some type of a script and orthography. It doesn't mean that we're processing them necessarily at the same level. Spanish, for example, is very syllable driven. And so phonological processing is a much better way of capturing that than phonemic. Phonemic isn't as informative as syllable. With Chinese, you really get kind of, oh, I'm going to go back to Arabic because I know this really, really well because I've been reviewing all these papers recently for Arabic languages. It's really at the morphemic level and takes diacritics to kind of indicate things. And so you're really at a different level. So the segmental area of the speech stream that you're processing and is most informative in the print will differ, but not the fact that you're taking oral language and putting it into print. So don't take this to say that, look, all the same basic areas light up, so we should teach it the exact same way. Yeah, we're going to directly teach things, but the level of analysis at a word that you're going to focus on when teaching might be a little bit different. And also the complexity of the correspondence between the oral language and word formation down to the print formation will vary as well. So the big idea here is that oral language is the foundation that we have invented and added in attention and visual processing at higher levels in order to achieve as a species. Which brings up, what about people like me? That is really, really hard for us to learn how to do that, to acquire that skill. What's it like for us? Well, I want to try to take a really simple approach here. All of my research has been in English. I've been very Anglo-centric in how I've thought about this for about half of my career, but I've definitely had to expand through my editorial responsibilities for an international journal to broaden my depth of knowledge. It wasn't that I was biased and only thought that English mattered. It was that I hadn't educated myself to understand the variations in the subtleties of presentation of dyslexia across different languages, especially the written forms of those languages. But ultimately, what we all see is it's a word level challenge. And so the behavioral presentation will be initial inaccurate word reading and decoding, especially in the alphabetic language, we would call it decoding. We'll see spelling deficits, and then we'll see a persistently slow rate of learning. The most important thing across all writing systems is the automaticity, the speed with which we can engage in that. Even if I, as a compensated dyslexic, when I read, I'm still slow, and you can tell, especially with unfamiliar text and text structure, that I'm not quite the same as as somebody who's reading and it was more easily for them to acquire it. So you'll see this prolonged learning to be accurate of reading words and spelling them across childhood. And the complexity of the writing system will dictate how prolonged that is and how much practice and explicit instruction it takes to overcome those. And then you will see a persistent challenge with how fluent we can be with the reading. The proximal causes have historically been viewed as being aspects of how we process the speech sounds in oral language, phonological processing deficits. How we orthographically map those between different aspects of what you saw, how we map those oral language pieces down to the visual processing areas. And pronounced issue with automaticity with how we go from that print to sound to actually being able to read those out to you. We say that the distal causes are going to be difference and variations in genetics across the entire genome, which we don't understand well. It's best to say that it's linked to this, so we know that there's a high risk in families of a person with a child. If you have dyslexia, having a child that'll have dyslexia. That gives rise to differences in our brain structure, which is unremarkable because if we're going to struggle with reading and we know it's a brain behavior interaction and connection, then if a person struggles with reading, it's probably going to show differences in how their brain functions. And that's what we've shown for the past 20 some odd years, that we've been able to use non-invasive brain imaging techniques like fMRI and PET scan to explore the brains of people who read well and learn easily versus those of us who are struggling to learn as easily and often struggle and have persistent problems. It even gets into our brain wiring, and we see differences in how our brains are wired. The key thing here is that there's protective factors and there's risk factors. And those protective factors can be environmental, and they can also be intrinsic to the child. So you could have a risk factor of having a genetic predisposition because of family history that you were passed on in your genes in yourself that makes it a lot more likely that you'll struggle to acquire the skills it takes to become a proficient reader. You have environmental risk factors too, such as not having a really awesome preventive-based model in your school that's going to teach you these skills in a direct way and give you lots of scaffolded support and practice to prevent you from having those problems. And the severity that a person might present with in any of these types of behavioral presentations up in that blue box will be influenced by these risk and protective factors. So there's both environmental factors and there's intrinsic factors, meaning intrinsic to the person. My buddy Hugh Katz will probably talk about this more so when he presents next month on the topic. This is the definition that we have for 2002 from the International Dyslexia Association. I'm actually going to scan through this because I can see that I don't have tons of time and I want to definitely get through the rest of my slides. I'm also going to skip through these. I'm going to skip to the last. Well, I have no clue what that is. We're going to take that off real quick. Stop sharing. Look at me. There's nothing to see here. But I want to blaze through those because I've really told you the take-home message from those. And I want to move into what you guys all signed up to come and see about, which is the mental health challenges. So let's go back to those. So as I was saying, across orthographies, we see a persistent issues with automaticity. The ease with which we learn to be accurate will vary based on the difficulty of the orthography and how complex it is. Here's the thing though. As we've been reconsidering the definition, there's a group of us that are doing this right now with the International Dyslexia Association. One of the things that's become pronounced to us is we've often talked about how acquiring vocabulary when it's hard to read and when you're acquiring it from print could actually result in secondary consequences of decreased vocabulary development. We've talked about how a secondary consequence when it's hard for you to read words could be that you have troubles with comprehending text because it takes the fluent reading automaticity to free up the cognitive workspace it needs to really develop the text models to comprehend text. We haven't thought about the consequences of struggling when you're so young academically. What's the impact on your mental health? So unfortunately, for those of us, it's confirming what we who live with this, and this is our lived experience, have known since our childhood, that this definitely impacts our self-esteem, how we think about ourselves, our depression, and our anxiety. Doesn't impact the externalizing as much. We don't hurt other people, we hurt ourselves, is how I like to paraphrase it. Numerous studies have now observed high prevalences of anxiety and depression among those of us starting in childhood with dyslexia and at much higher rates than the general population. I like to highlight that there have been 3 recent meta-analyses, studies on studies from different research teams here. They've all looked at variations in this. So let's say the top one there was looking at individuals with reading disability and demonstrating that they had more internalizing problems across all the studies that they reviewed, then those would be the internalizing, so again, anxiety and depression are the most prominently known, then their age-matched peers who don't have a reading problem or a learning disability. And then say the next one down, between poor readers, not even identified necessarily with a reading disability, just poor readers, struggling readers, were experiencing, again, more internalizing problems than their typical readers. And then down here with Donalato, a recent meta out of this research team here, we're again seeing that kids with these language learning differences were showing these differences now in the internalizing, and they also looked at externalizing here. So these oppositional defiance types of things are emerging from what their review was. And you'll also notice in this bottom one that they're looking at both the uh, like the specific learning disabilities of reading, but they're also looking at language disorders more generally, more like a DLD type of thing. So overall, what we're seeing is that there's these internalizing problems, and there's some evidence of externalizing. The caveat here is that there's been lots and lots of research done on depression and anxiety that we've been able to review kind of as a research community, and a lot less studies on the externalizing problems. So those kind of conduct, the externalizing types of things that you see overtly coming out. I like to think about this in the model that kind of takes a developmental perspective and places it in a social context. It's an older model, actually. It's from researchers out of Johns Hopkins University here in the United States. And what they really focused on was this idea of psychological well-being across the lifespan, starting in childhood. What gives rise to psychological success and health, and what gives rise to issues with those challenges when it comes to that well-being? And they're really focusing in on different aspects of that. They're really highlighting the social adaptation model between adaptive and maladaptive. And so this is going to be our ability at these different parts of our lifespan to resolve things that are important for us developmentally. And when you're a young child, you want to do well and make the adults in your life happy, right? And part of that is going to school and doing well in school. It's what your job is. At least in societies that have like schooling for everybody, so in our societies around the globe where schooling is mandatory, you're expected to do it as a child, it sets up a societal expectation that I will perform well in this context. And the basic premise of this entire model of mental health is one of the main drivers for issues with our mental health is when we cannot resolve these challenges or these moments in our lives that we have to fit societal expectations. So being a good student is a societal expectation, especially in literate societies. Being a good child who learns how to read and write well is an expectation. In different communities, there may be higher expectations of those driven there, creating even more vulnerabilities. The challenges that we experience for those are what creates vulnerabilities, one of the pathways for mental health challenges. So this development, as I've been highlighting, is happening in this ecological system, the systems that we're working in, our home system, our school system, the societal system that we find ourselves. And in literate societies, reading and spelling, which is really hard for those of us with dyslexia to do well and learn easily, is set up to be this thing that we're expected to be able to do. It should be what we're doing. And if we don't do it, we're just not a good member of society. It's just, I want to be really simple and straightforward and use pretty simple ways of talking about this. We're not good people and we're not good citizens of our society if we can't do these basic things that society expects us to do. And in literate societies, we're expected to be able to do these basic academic skills. And this is set up for us, and we're communicated by our parents, our teachers, and our peers, and our extended family and people in society. And it's what we're told. And those of us who live this reality experience every day of our lives. I hope that can convey to you that I could use all the fancy epidemiological words here, but the lived experience is this is our reality. And this theory resonates so deeply for me because this was the reality that I've experienced. And I know that so many people who have reached out to me, not just from the United States, from all over the globe, have expressed to me when they seek out to try to understand themselves as having dyslexia and they stumble upon something of mine that they read or they watch on YouTube. They're living these realities and they don't think that they can achieve what they need to. Be it a woman from India who reached out to me, who, like me, was a psychology undergraduate, who, like me, wants to go and be a scientist when she grows up, but she doesn't think she can actually do what it takes to be a scientist. But in her society, being a professional is prized, and she's really beating herself up because she's not meeting her parents' expectations and societal demands. So she feels maladaptive. She doesn't feel like she's right. She's bad. She's wrong. So this is what we have to resolve. And academics, especially in literate societies, doesn't go away for us easily. So the basic idea is that you could have this path to give rise to this. It could be, and there is evidence for this from extreme trauma. So my colleague and friend Yakov Pesher has published this. I don't want to minimize the impact of trauma and early childhood trauma on future academics. That's well documented. We're not going to talk about those extreme cases. Now we're going to actually, unfortunately and sadly, they're not as extreme and as unprevalent as we'd like to, as some of us might think. But for many of us, and when we look across the study I'm about to show you that was done across multiple large-scale studies across the world, the question that they're trying to get at is it depression that then leads to disengagement in academics in school that leads to future academic problems, which impacts our school achievement? Or is it often on average that when we struggle to fit into societal expectations and we struggle to read and spell, does that give problems to school achievement, which makes us feel like we're not adapting, we're bad, that gives rise to mental health challenges? I like to scare people with a scary model. MacArthur and her colleagues did a study using structural equation modeling that they published in 2022. I'm going to skip over here. They used 4 epidemiological data sets that were longitudinal, kind of at a population sample level. One is from the UK. That's the one that you see on the left that has the UK flag on that column. 2 are from the United States. They started at different times. One cohort started in 1998 and were tracked across early childhood. And then the other one started in 2010 and they were tracked across early childhood. And then there's a data set of the smallest of all of them out of Australia where they were tracked longitudinally. Her team pulled out things that she needed to look at literacy achievement and its relationship as cause or effect of which comes first, the chicken or the egg. Was it the mental health or was it the literacy? So what I'm going to show you first is when they modeled the data going from 5 years of age to 7 years, they're looking at early indicators of issues with mental health, predicting future reading ability. So going from 5 to 7. And they were looking at, does peer relationship across these different samples predict your future reading ability? And the answer they got was, oh, I skipped this because I needed to go for time here. Across almost all the studies, peer relationships didn't predict your future reading ability. Your levels of depression at 5 didn't predict your future reading ability. Your issues of externalizing and did, except for the Eccles. And in the Eccles, they actually measured attention. And the only study they measured attention in, all of a sudden, externalizing doesn't predict it. So it's hard to distinguish between externalizing and attention problems here. And then anxiety, it was no and no. I wanted you to just notice, I just did it really simple. Is it a yes, it predicts, or is it a no? And overall, you see a lot of no's, except for attention or attention-like types of things, disruptive type behavior. Definitely disruptive behavior is a problem for learning and literacy. But then the next question is, do reading problems at 7 predict your future mental health outcomes in peer relationships at 9 or 11? Most of this is at 11. One of the samples is at 9. And it was always yes. So if you struggle with reading more, your peer relationships aren't as good later on in life. If you struggle with reading more at 7, then your depression and internalizing symptomatology is worse later on. You have more externalizing behaviors, your attention is worse, you have anxiety, you're more likely to get bullied, and your reading concept is low. So there's some evidence that disruptive behavior that would disrupt your learning is a challenge for future reading. But there's overwhelming evidence that when we struggle to read, it causes problem. So failure to adequately adapt in this model to these challenges of learning how to read is setting us up for depression and anxiety, which then would even further exacerbate our school achievement. I want to get into now, how do we address this? And actually the cool thing is how we're addressing it also gives us causal information about mechanisms because of how these studies have been done. So if the antecedent is going to be reading that gives rise to issues with school achievement that would then have problems with depression, that's the path. Then what we would do is intervene to improve our reading ability and school achievement to make our depression and anxiety better, right? If for most of us, the root cause is we're not able to be good kids, we feel maladaptive because it's hard for us to learn how to read and spell, teach us how to read and spell. And that'll help us with our mental health. Well, it just turns out that the person who generated and created that model I was using, the epidemiological model, that developmental model, taking a social context, Kellum, all the way back in 1994, tested that hypothesis. He controlled if kids were getting what today in the United States we would call a tier 2 intervention in first grade. And what he found was in a randomized controlled trial, if he assigned kids to get a structure, what we would call now a structured literacy tier 2 intervention, and if it addressed their reading problems, guess what? They had fewer depression symptoms than the kids who didn't get that intervention. And that's just amazing, right? How do you get mental health in kids who struggle to read to be better? Kellum said you go to the root cause for many of these kids. It's their academic underachievement. It's their fundamental issues with reading. If we can help them to do that better and give them the scaffolded support we need with what we would now call structured literacy, guess what happened in his randomized controlled trial? Those kids presented with less depression than the kids who didn't get that type of support in their school in his randomized controlled trial. Marianne Wolf worked with an Italian colleague of hers, I'm not going to pronounce that name. Again, I have some language processing differences, phonological processing being one of them. Her colleague in Italy, they took and did an Italian version of the RAVO program that Marianne generated. And what she did is find them very similar results using second grade kids, to where when they got RAVO, it actually improved their mental health well-being as well. And then more recently, Amy Grills and her colleagues, Sharon Vaughn and others, did a replication, in essence, of Kellum's study. They're now calling it Tier 2 because we're now in 2023 and we're in a mode in the United States of an RTI MTSS model. So what they did was they intervened with second grade students as part of a randomized control study. Students who responded better to the Tier 2 structural literacy they were receiving experienced greater declines and their internalizing symptoms, especially the depression symptoms. So then the issue here that I want to highlight is it's never straightforward. Once we start to develop, and why prevention and good early intervention is so important, is once we start to develop these mental health challenges, we pull away from our trigger. And that's the problems we have with reading and writing. So what they also found evidence is those students who started off with more internalized symptoms at the beginning of the year didn't respond as well to the Tier 2 instruction. So intervening early to prevent the manifestation of those Tier 2, I think is really critical for us to think about as educators. That's kind of a summary over there. That's early on. And so then what would we do for these kids as they materialize and they're dealing with these challenges? One way that people have normally done, us adults, I'm going to say adults who are not like me, because I did not think this way for very long. Other adults thought that it would be great to bring in mental health professionals and just treat us like we're patients and then fix us. Because what we know is that we start to have issues with peer relationships as a result of this. We start to feel the social stigma of having labels that society thinks are less than and other than. And so even if you do get the label of dyslexia or a learning disability, having the label of a disability, we know from social psychology research is stigmatizing and makes you feel less than other people, which impacts your self-concept as being unworthy and your self-efficacy and your self-esteem. All of these are the hallmarks of pathways to depression and anxiety, right? This is not good stuff here. But how might we engage in ways to combat these things, even if we've developed them? So one of my friends, I won't call her a friend, but somebody who I respect very much, and a colleague of mine too, Famiko Hafe, and Stephanie Half at the time, who was one of her students, did this study looking at near-peer mentorship. What does that mean? You're going to be mentored by a peer. A peer is somebody like you. And that psychological likeness can be on many different domains. They picked that it's somebody like me because maybe like me, they have ADHD. Maybe like me, they have dyslexia. Maybe like me, they have DLD. It's near because they're psychologically near to you. Nearness can be created because, well, you're a peer in this way that I actually am needing support with, like a learning difference. Near could be age. So you can create nearness and psychological closeness and not distance. And I actually work with the little kids in my center and I do peer mentorship. And it's because we have this difference about us. We're all dyslexic, that they feel close to me, and it allows us to have a mentorship program where we engage in different things. And so that psychological nearness isn't because they think that I'm like them. And the ones that I've worked the most with have been little girls. They don't think I'm a little girl like them. They can see themselves in me and I can see myself in them because they can relate to our struggles. And we have the lived experiences to resonate. And when we talk to one another, it's authentic and we feel close. And that's what it means to be a near peer mentorship to me, when I use my words and not my psychological words I would be using as a trained psychologist. So we're going to introduce this peer mentorship, or at least Stephanie did in her randomized control trial. And I think this is really, really important. It's an older study, but it's so powerful because so few researchers have actually impacted in older children any aspect of mental health. What she did was she had a control group, so typically developing for reading or for this aspect of themselves like attention. Then she had one group that wasn't mentored, who was just tracked, who had either a learning disability, most of them had dyslexia, or ADHD, or both, because you know that's so high comorbid. And then there was the mentored group. So this was the group that was tracked over the course of this year, and they got mentorship, and they had, again, a learning disability. Most had dyslexia and or ADHD. She looked at changes in self-esteem, interpersonal relationships, depression and anxiety, and she did this in middle school. Now, middle school is important because what you'll see is that self-esteem, the typical developing kids, no change. The kids who were not getting support by peers decreased in their self-esteem. But the kids who got mentored by peers to help them understand themselves, how they fit into this, to society, how they fit into, how they can thrive, they increased in their self-esteems. What about interpersonal relationships? And remember, it's middle school. And I don't know, at least in the United States, that's not a fun time for most of us. So you'll actually notice that the control groups who weren't mentored decreased in their interpersonal relationships in middle school, not surprisingly. So did the kids who had the learning differences in ADHD. And then she just held the kids steady who got mentored. What about depression? No change in depression symptoms in the control kids. You saw increased depression symptomatology for the kids who had these learning differences who weren't mentored, and you saw a decrease in depression in the kids who got near peer mentorship. This is really remarkable because adding cognitive behavioral stuff to therapy hasn't been helping. Bringing in people to do a little bit extra kind of work with this stuff hasn't been helping as much as this has. And then what about anxiety? I think anxiety is the one that, as I've read the literature and I've talked to my peers who are doing this work, we're seeing the least response to, and we're not sure why, but there was no change in anxiety in what she showed. So in this initial study, and there's been a small review article that Fumiko's published subsequent to this more recently. I think it was just last year that it was published. This is showing real promise to where those of us in our community can actually help one another to understand how we can fit into society, to not feel maladaptive, but to adapt to society and fit in. So when it's early, we can prevent. We can prevent those reading and spelling challenges, give us the skills we need, the support to intervene with instruction and intervention in a prevention-based model, and improve our school achievement and prevent and reduce the occurrence of depression. That's what we're seeing across those studies that I reviewed. Once it starts to emerge, what do we do in those upper elementary and the middle school? Well, it seems like, yes, there is evidence that maybe some type of mental health professionals coming in is helpful, but this actually developing peer mentorship programs in schools shows a lot of promise for empowering and giving agency to the individuals themselves to give back to younger ones and to feel empowered by people who they can see themselves in and feel close to psychologically. So I think those are the two paths. We intervene, prevent using structured literacy. Stop it from happening in the first place. And then it's never too late to intervene to teach us these things, not even in adulthood. So we can always intervene with these things. So don't think it's too late. We're never a lost cause. And we can foster opportunities to allow those of us with dyslexia to support each other. And that seems to have one of the biggest positive effects on our psychological well-being. So you guys, if you're educators, you help by doing your jobs really well at educating and leveling up your game by putting a great prevention-based model to help us acquire those skills and support us in doing that hard practice and the work it takes for us to acquire literacy for ourselves. And as educators, you too can support and foster opportunities as community organizers, fostering opportunities for to create support groups for us to support each other in our own psychological well-being. I got a lot of references. There's a lot of research behind this, and those are here, and there's even more. And I want to just thank you guys for taking time out of your day to hang with me on that. I hope you learned something.
Thanks so much, Dr. Odegard. I'm Elizabeth Hogan, the president of our Reading League Georgia chapter, and we appreciate you kicking off this series for us. It was really cool because I know you were condensing your presentation, and as I was going through all the questions that were submitted, which thank you to those of you who submitted questions tonight. I noticed you really hit a lot of them, and a lot of the ones that I wanted. Yeah, you did great.
Good
So
job. Mission accomplished. I'm done. Bye,
I
guys.
it really is true. So I really wanted just to highlight because I had not seen the research from Kellum and Grills, and kind of the one of the biggest questions we got asked was, does early detection and appropriate intervention help decrease these negative emotional impacts?
Yes.
And I feel like you answered that, and the answer is yes. And so I
Sounding
guess
yes.
yes, resounding yes. So with the timeline, I know some of the research was looking at first graders, and then we talked about the mentoring model with older kids. So do you think as far as early as we can be giving
Yeah.
actual instructional interventions, we are going to help prevent? And then when we've kind of gotten to past that point with kiddos, when is a good time to, obviously we still want to be giving the emotional instructional supports to our students that are struggling readers, but when is it all good? It's the instructional stuff and the mentoring, or is there a certain time that the mentoring ships looked more or had a better impact?
So I don't think we know from the research all the answers to the questions you just asked. I will say um, that the work that Grills has done with Jack Fletcher and Sharon Vaughn has been across kind of, I believe it was second grade. They also did a fourth grade study, and they saw much better effects early on with the second grade study than they did in the fourth grade study. And they definitely see they see that the depression, especially in the older grades, was definitely impacting the effectiveness of the intervention. So many of us who were trained in a structured literacy intervention to work with children with dyslexia have a social emotional piece to our training, or at least I hope you did too. And that we know that we engineer our situation to be high success and low failure. And we try to calibrate desirable difficulties, and we foster a lot of support. Um, at least with what I was trained to do, we also opportunities for creative outlets for expression as well, and allowing those to be praised and seen. And so we're creating a really holistic kind of situation for kids. I think that's really important. So yeah, I think that yes, and then Kellum actually was in first grade, so it would be beautiful if we could go even further and launch, and hopefully someone will get funding from an agency or a foundation to start early, look at your risk weight. So what we would have in like kindergarten or even pre-K would be your risk calculation of what it is that you're likely going to struggle with the reading and spelling words, set you up for success, see if we can remediate and or prevent those from happening or lessen the severity, but not do what we've always done for the past 3 or 4 decades and just measure the academics, but start tracking early on and have indicators of mental health. Because the hypothesis would be that as your risk factors go up, the likelihood of more severe challenges will be there, so that'll be the ones who will still need more intensive intervention, and little band-aids won't work when you get to second, third, fourth grade. But we want to prevent the magnitude of the severity, because the challenge about dyslexia is it's not black or white, yes or no. It's on a continuum of severity, right? And some people have compensation and upsides. I had some compensatory strategies that allowed me to overcome things and do what I've been able to do, but still I present with fluency issues and I have all the mental health issues to go along with it. So anyway,
Yeah.
there's that. So I think that the developmental trajectory is really, really there. I know that the earlier use of peer mentorship, especially maybe in upper elementary, could probably be brought in. And I think it would be wonderful to think about and see this if you're in the US context of an MTSS. MTSS is a beautiful model, and we often think that there's behavior in academics, but think about what I just showed you. The academics can feed to behavior problem. We've known that for a while. The academics can actually support the behavior. So I remember an early study that when I was at a previous post, hi Peggy, I really was zeroed in on because it was this neat study out of Arizona State University where they were bringing in kids who either had language differences, weaknesses in phonological processing into tier 2, and they got a double dose of foundation in an RTI model, or they had some conduct problems in the class that were disruptive and they were coming in. When you come into a small group setting, it gives you a closer ability to do two things: behavior management, because you have a lower teacher to student ratio. And it also allows you to intensify with instructional intensifiers, your instructional and academics, right? So they double dosed the foundations. They went into those word skills, they double dosed. The trajectory was all kids learned from foundations in that tier 2. There was gains of met call, but unremarkably, since there was no risk for language problems that would give rise to reading and spelling, once they controlled the behavior through academic changes that had behavior management incorporated, those kids took off who came in with the ODD and they got mainstream back out. But the kids that came in with the phonological processing differences, their growth was there, but slower, escalated into the tier 3. You differentiated not through neuropsychological testing or a bunch of human time. You differentiated by thinking creatively about the interface between the behavioral and the academic and how they're actually symbiotic and they feed on one another. And that sometimes part of the solution for one is very similar to the solution for the other. And you can actually differentiate. There will be some kids who will have behavioral challenges and language differences and other things that will exacerbate it. It wouldn't just be managing the behavior will give awesome results in response to foundations, help them catch up from what they lost because they weren't paying attention as well because they were disrupting the class and keeping and doing the same. So I hope that kind of gives you an answer. We don't know the answer, but I think we can sketch out the importance of doing this and some strategies about how we would do it in classrooms in different settings. And also the importance of thinking synergistically about the behavioral side and the academic side of MTSS.
Yes, and thank you for addressing the MTSS part because people did ask about that as well. I just think the really cool thing is that yes, we do know that early intervention is going to impact and help with the emotional tolls of dyslexia. And kind of along the same line of cause and effect, or is there research or have you seen or heard things about the correlation between ADHD and peer relationships or those internalizing behaviors? Is there kind of something similar?
Yeah, there is. So yes, all the things that we would consider a learning difference and or attention, which often gets kind of put in this cluster, there's evidence that's emerged. Obviously, given my focus and what people often want me to speak to, I speak to those. I think that because of the underlying mechanisms that give rise to human behavior in ADHD, and the fact that cognitive regulation needed to do executive function type tasks is very similar and relies on very similar areas in the dorsal prelateral frontal cortex, which we often see as dysregulated in people who have ADHD, are needed for emotional regulation. So you see that one of the symptoms of ADHD can be emotional dysregulation, tantrums, hard keeping their emotions in, blurting out. You also, not surprisingly, given the high occurrence between ADHD and dyslexia, we'll see some overlap in that as well with the dyslexic individuals that could be exacerbated because of maybe subclinical levels of some attention problems, but not clinical, not enough to be disruptive under typical daily function. But you put us under a little bit more stress, Anybody who's worked with us or lived with us knows that we can, without a lot of work and a lot of me sitting zazen, can kind of check out and kind of lose my cool over things. And so that's emotional regulation. That area of the frontal cortex is interfacing with different subcortical regions when it comes to emotional regulations. It's going into the HPA axis and into the amygdala in different pieces, whereas the areas there are then interfacing back with the language centers to do language processing, but it's being driven out of a very similar neurogenerator, which is dysregulated with people who have ADHD. So yeah, we do see those, and it's also going to be because their behavior is not viewed as positive. They're viewed as disruptive. They're viewed as having those things. So they come in with the same social vulnerability because of how their behavior is interpreted and the social stigma that comes with it as somebody who's viewed as a dum-dum because they can't read and spell. That's where this is coming for a lot of us. Again, trauma can also cause problems with academics, and that is well documented. And there's some really extreme cases coming out of extreme neglect of children in European countries that document the importance of both brain maturation for that as well as academic performance. So I don't want to mitigate that, and I never want someone to think that I'm making it so simple as to say there's no link between early mental health and future academics. There definitely is, and the big driver early on for that mental health is psychological trauma and neglect, which is
Gotcha.
way too prevalent, and we should eradicate that as a society.
Right. Well, that makes complete sense. Lastly, just because I know we are getting tight on time, because it seems that this peer mentoring was so positive. Do you have some resources that you can point us as practitioners and parents to kind of more about like how that was done, or some information that we might be able to go get more and, to present to our schools, to present to our communities?
I can, and I always say that I have no financial conflict of interest here. The one that Stephanie used was Eye to Eye,
Okay.
and it's a common one here in North America that's used. It was actually created by somebody who himself is neurodivergent. He has attention differences in how he functions in the world and how he functions internally. And so if you go to Eye, you can learn more about that. I, you guys were saying that you're going to point to my podcast. I
Mhm.
have an interview with Stephanie Haft on my podcast. I don't produce my podcast anymore, guys. It was way too much time and drain for me. I'm glad those of you that gave me positive feedback and kudos. The haters, there were like two of you. That's okay. But the rest of you, thank you. I have an interview with Stephanie and we talk about this. Also, if you want to go and link into Rebecca Gottlieb's, brilliant young scientist, really awesome human being too. Both Stephanie and Rebecca I showcased early because I was showcasing young female scholars who were just doing exceptional work, and both of them fit that bill. Rebecca was a mentor for Eye to Eye in college, and so she talks about some of her personal experiences with it. And in the show notes, I would always provide links. So if you give a link to Stephanie's show that I did with her, I have links to some papers and also to Eye to Eye.
Okay, perfect. That's awesome. I know we always want to, have something tangible to take away. So that's a
There you go.
podcast, and we can look for Eye to Eye. All right. Thank you so much. I don't think
Thank you.
any of your haters are present tonight, Dr. Odegaard.
I
You're
did
too.
my so hard. Thank you.
No, they are not here tonight. We all really appreciated this. So, we just are appreciative of you kicking us off, and we're so excited about our following presenters as well for the rest of this series.
Yeah,
So,
you better do a good job because I just knocked it out of the park. Come on, kid. Come on.
exactly. We're going to tell him. We're going to tell him. So for all of us here tonight, if you have colleagues who missed the webinar, let them know that all registrants will receive a link to the webinar, a recording, and the slides from the presentation. You'll also have the opportunity to fill out a knowledge check and a request for certificate of attendance. After you view the webinar, either tonight live or the recorded version, the form will be sent out next week, and you'll have 1 week to resubmit the form. And if you fill out the form, you'll receive your COA the day after the deadline for submission. On behalf of the boards of IDA Georgia and the Reading League Georgia, we so appreciate you attending our webinar this evening, and we hope that you have a wonderful rest of the night. We look forward to seeing you at our next webinar on February 19th with Dr. Hugh Katz. Thank you so much again, Dr. Odegard, and thanks to everyone who attended tonight.
Bye, guys. Ciao.